Assalamu alaikum students. I hope you all are doing fine. On the behalf of Anatomy Department of the Said Medical and Dental College, I am Dr. Amna Rafeel here to present you our today's topic, that is the gross anatomy of nose and paranasal sinuses. So before going into the detail of our today's topic, so let's have a brief introduction about the nose. That the nose is the word derived from a Greek word that means rhinos, and so that's why the study of the nose and its diseases is called rhinology. So the nose has two parts basically, the external nose and the nasal cavity. And here you can see that the nose has a prominent feature that is visible, that is most prominent on the face, and that is basically known as the external nose, and that leads to inside a cavity that is known as the nasal cavity, which is being divided by the nasal septum into two halves. So we have two nasal cavities on the right side and the left side. So let's see the functions of the nose. The functions of the nose includes, of course, it acts as a passage for respiration, and it is also a organ for olfaction, and it adds resonance to our voice. And its mucus secretions helps to trap the foreign particles, so it also protects the airway as well, and it also air conditions or humidifies the inspired air. So let's move forward with the part of the external nose. So external nose, as I told you, that the nose is overall divided into external nose and the nasal cavity. The external nose is the part which is the most prominent, and it is pyramidal in shape, as you can see over here. And its different features include the root of the nose. This one is the root of the nose, and this is basically the upper narrow end of the nose just below the forehead. So this is the root of the nose. Then the dorsum of the nose is basically a prominent ridge which separates the right and the left halves, and the lower end of the dorsum is known as the tip of the nose. Then we have the columella. Over here you can see this one is the columella. This columella, the two nostrils or nares are separated by this columella, and it is continuous internally with the lower part of the nasal septum, which is separating the two nasal cavities. Then we have the supporting framework of the nose is formed by, as you can see in this diagram, this is all external nose. The supporting framework is formed by bone and the cartilage. The bony part forms the upper one-third of the external nose, and it is formed by the nasal bones in the frontal process of the maxilla. While the cartilaginous part contributes to the lower two-thirds of the external nose, and it is formed by the septal cartilage. Over here you can see the lateral nasal cartilage, the major alar cartilage, and the minor alar cartilage, and a small alar fibrofatty tissue forms the part of external nose. Now let's discuss the nasal cavity. As we did that, the nose was divided into an external nose. We did the parts of the external nose. Now we'll discuss the nasal cavity. The nasal cavity, it extends from the external nares and to the posterior nasal apertures, also known as the guana, and is subdivided into right and left halves by nasal septum. So this is a part of the nasal cavity that is being shown, and the nasal cavity has a roof, and it has a floor, and it has a medial wall, and it has a lateral wall. So let's discuss first the roof of the nasal cavity. So the roof of the nasal cavity is in the form of slope: anterior slope, the middle horizontal part, and the posterior slope. The anterior slope is formed by the nasal part of frontal bone over here. Then we have the nasal bone, and we have the nasal cartilages. While the middle part or horizontal part of the roof is formed by the cribriform plate of ethmoid bone, and the posterior part of the slope of the roof of the nasal cavity is formed by the body of the sphenoid bone. So here you can see this is the anterior sloping part formed by the nasal cartilage, nasal bone, frontal bone. The middle horizontal part is formed by the cribriform plate of ethmoid bone, and the posterior sloping part is formed by the undersurface of the body, the sphenoid bone. Floor over here, you can see it is formed by the hard palate, and as we did earlier, that the hard palate was formed by the palatine process of maxilla in anterior 2/3 and the horizontal plate of palatine bone by posterior 1/3. So the floor is all formed by the hard palate. Then we have the medial wall. This one is a medial wall. We discussed that the nasal septum was dividing the nasal cavity into two halves, the right and left half. So of course the nasal septum will be forming the medial wall of both the cavities. The lateral wall over here, as you can see, it is irregular, and is irregularities because of three bony shelf-like projections you can see over here. These are known as the turbinates or concha. Now let's see how the nasal septum is formed, and we did that. The nasal septum was basically dividing this whole aperture into two halves. Here in you can see the diagram. This is the piriform aperture of the nose. This aperture leads posteriorly to the nasal cavity, and this nasal cavity is being divided into this median partition, that is known as nasal septum, into two halves, right and left halves. So what is the nasal septum? Nasal septum is a median osteocartilaginous partition between the two halves of nasal cavity. On each side, it is covered by mucous membrane and forms the medial wall of both the nasal cavities. Yes, we know that. And as I described that it is an osteocartilaginous, so the bony part of the nasal septum you can appreciate in this diagram. Then these are the bony parts. The bony parts are formed by the vomer, the perpendicular plate of ethmoid bone, and this also receives contributions from the nasal spine of frontal bone. Over here you can see this is the frontal bone and this is the nasal spine. Then we have the crest of nasal bone, nasal crest of nasal bones, and then we have the nasal crests of palatine and maxillary bones as well. So this was the bony part of the nasal septum, that was vomer, perpendicular plate of ethmoid bone, rostrum of the sphenoid bone, nasal spine of frontal bone, nasal crest of nasal bone, and the nasal crest of palatine and maxillary bone. While the cartilaginous part is formed by the septal cartilages and the medial crust of a medial process of the lower lateral cartilage, also known as the inferior nasal cartilages. The cuticular part is formed by the fibrofatty tissue. We studied that the lower part, which was dividing the nasal cavity into two halves, was a columella. The septum has a superior border and inferior border, and it has anterior border, posterior border, and it has two surfaces. Both the surfaces will be forming the medial wall of both the nasal cavities. Now let's discuss the blood supply of the nasal septum. Students, this is the most important part of our today's lecture, and you have to understand and memorize this. It's clinically important as well. The arterial supply of the nasal septum, we have divided the nasal septum arbitrarily into four parts: the anterior superior part, and we have the posterior superior part, then we have the posterior inferior part, and this is the anterior inferior part. So this is anterior superior, anterior inferior, posterior superior, and posterior inferior part. By an oblique line, we draw that imaginary oblique line, and that divides into the four parts: the anterior superior, anterior inferior, posterior superior, and posterior inferior. So the anterior superior part, as you can see this one, and this is supplied by the anterior and posterior ethmoidal arteries, which is the branches of ophthalmic artery. Then anterior inferior part is supplied by the septal branch of superior labial branch of facial artery, which is a branch of external carotid artery. Then the posterior superior part is supplied by sphenopalatine artery, which is a branch of maxillary artery. And the posterior inferior part is also supplied by this greater palatine artery. So the anterior inferior part, you see over here, this circle area, the blue area, the anterior inferior part of the septum contains anastomosis between all the branches. Basically, they are four in number. That is the septal branch of superior labial artery, anterior ethmoidal artery, sphenopalatine artery, and greater palatine artery. These four arteries, they anastomose with each other and form a capillary network, and that is known as Kesselbach's plexus. And this is a common site of bleeding from the nose, and that is known as epistaxis. So that's why this anti-inferior area of the nasal septum is also known as the Little's area. The veins form a plexus which is more marked on the Little's area, and the plexus drains anteriorly into the facial vein, and posteriorly they drain into the pterygoid venous plexus through sphenopalatine vein. So students, I have just repeated my previous slide over here in a more precise manner so that this slide can give you a glance of memorizing the important thing over here, and that is basically I have described you that Kesselbach's plexus or Little's area of epistaxis is a highly vascular area at the anterior inferior part of the nasal septum, where there is an anastomosis of the four arteries, which are the septal branches of anterior ethmoidal artery. Over here you can see. Then we have the sphenopalatine artery. Then we have the greater palatine artery. And then we have the superior labial branch of the facial artery. These four arteries are basically forming anastomosis at the anterior inferior part of the nasal septum. And this area is known as the Little's area, and the plexus formed by them is known as the Kesselbach's plexus. So that is the most common site of from where the nosebleeds occur. So the nerve supply of the nasal septum is again just like the blood supply we did in the form of four parts. You can see from the diagram directly that this anterior superior part is innervated by the anterior ethmoidal nerve, as you can see, and particularly the internal nasal branch of the anterior ethmoidal nerve supplies the anterior superior part of the nasal septum. The anterior inferior part of the nasal septum is supplied by the anterior superior alveolar nerve, which is a branch of infraorbital nerve. The posterior inferior part of the nasal septum is supplied with this nasopalatine nerve, which is a branch of pterygopalatine ganglion, while the posterior superior part is innervated by this medial posterior superior nasal branches from the pterygopalatine ganglion. The special sensory nerves for the olfaction, they are carried by the olfactory nerves, which are confined to the upper part of the olfactory area. So these olfactory nerve rootlets together form the olfactory nerve, which is carrying the special sensation of olfaction. The lymphatic drainage of the nasal septum is from the anterior half of the nasal septum goes to the submandibular lymph nodes, while the posterior half goes to the retropharyngeal and the upper deep cervical lymph nodes. Now let's discuss the lateral wall of the nose. The lateral wall of the nose, which was forming the lateral boundary of each nasal cavity. The lateral wall of the nose is irregular. I told you earlier, as you can see in this diagram, it is irregular. It's not smooth. It is irregular because of the presence of three bony shelf-like projections, and these projections are known as the concha or also known as the turbinates. And the purpose of these shelf-like projections is that they increase the surface area for the effective air conditioning of the inspired air. Now this lateral wall can be divided into three parts from before backwards. If we go, you can see this part known as the small depressed area and the anterior part of this lateral wall. This whole is lateral wall. This depressed area and the anterior part is known as the vestibule of the nose, and this is basically lined by modified skin containing stiff curved hair known as vibrissae. Then in the middle part you can see this is the atrium, also known as the atrium of the middle meatus, and is present just above the vestibule. So this is the vestibule. This atrium is present just above the vestibule, and it is limited superiorly by a mucosal ridge, and that is known as agarnizae. Then we have the nasal cavity proper, which basically contains the three concha or the turbinates. So the lateral wall of the nose is irregular due to the presence of three shelf-like projections which are bony, and they are known as the concha or the turbinates, which increase the surface area for the effective air conditioning of the inspired air, and is divided into the breast part anteriorly known as vestibule. The upper part is known as the atrium, just behind the vestibule. Then this atrium is limited above by a mucosal ridge, and that is known as the agonizai. And then we have posteriorly a nasal cavity proper that contains the three conchas or the turbinates. These conchas are separated by these narrow passages you can see underneath them, and those are known as the meatuses. Now, just as we did the supporting framework formed by forming the nasal septum, the same way the lateral wall is also being contributed by the bones and the cartilage as well. So the skeleton of the lateral wall is partly bony and cartilaginous and also made up of soft tissues as well. So the bony part, students, please make sure that you have to memorize these contributions, and these are being frequently asked in your exams. So the bony part is formed from before backwards, and those are the bony part are the nasal bone. Over here you can see this is the nasal bone. Then we have the frontal process of maxilla. This is the frontal process of maxilla. Then we have lacrimal bone. Then we have the labyrinth of ethmoid bone, and this is basically having superior and the middle concha. Then we have inferior nasal concha, and it's not a part of any bone. It is a separate spongy bone. So inferior nasal concha is not a part of any bone. It's a separate spongy bone. And then we have the perpendicular plate of palatine bone, and then we have the medial pterygoid plate. So from before backwards, the bony part include the nasal bone, frontal process of maxilla, lacrimal bone, labyrinth of ethmoid with superior and middle concha, inferior nasal concha, a separate spongy bone, and then we have a perpendicular plate of palatine bone, and then we have the medial pterygoid plate. While the cartilaginous part over here, you can see it's formed by the septal cartilage, septal nasal cartilage, major alar cartilage, minor alar cartilage, and a alar fibrofatty tissue as well, which is basically the soft tissue part contributing the lateral wall of the nose. Now let's see what are the conchas and what are the meatuses and what are the structures opening in these meatuses, which is again a very important thing to know and understand. So concha, as I told you earlier, these are the shelf-like bony projections present in the lateral wall of the nose, nasal cavity, and it is basically the superior and the middle ones are the projections from the ethmoid bone, while the inferior meatus, is a separate spongy bone. So we have three conchas: superior, middle, and inferior. And meatuses are the passages beneath this overhanging concha. So you see these oblique passages just beneath this concha. These are known as the meatuses. So we have three meatuses for the three concha. So this is a very easy schematic diagram to show you what are the structures or opening into the different the three meatuses of the concha present in the lateral wall. And these oblique lines, students, in this diagram, these oblique lines show you that the conchas have been removed, and what we are seeing over here are the meatuses and the structures opening into these meatuses. So first of all, the superior meatus that lies, of course, beneath the superior concha. This one is the superior concha being cut, and the passage beneath this concha is known as the superior meatus. And what structure opens into that? This is the posterior ethmoidal air sinuses. So posterior ethmoidal air sinuses opens into the superior meatus. Then what is sphenoethmoidal recess? Just above the superior concha is a triangular shaped depression or fossa, and which receives opening at the sphenoidal air sinus, and that is known as the sphenoethmoidal recess. So in this diagram again I'm repeating that the concas have been removed to show you their meatuses that is underlying over the overhanging concas, and what are the structures opening into that meatuses. So the superior concha have been removed, and what you can see that in the meatus of the superior concha or superior meatus, this posterior ethmoidal air sinus is being opened, while just above the superior concha there is a triangular shaped fossa which is basically receiving opening for the sphenoidal air sinus, and that is known as sphenoethmoidal recess. So the sphenoethmoidal recess will be lying above the superior concha, and it will be receiving opening of sphenoidal air sinus. Now let's do the middle meatus. This concha has been removed, and what you see is the meatus, that is the oblique passages beneath this concha. So what we see, first of all, the structure which we see in the middle meatus is the ethmoidal bulla. It is a rounded, this is all ethmoidal bulla, and it is a rounded elevation produced by the underlying middle ethmoidal sinuses which open at the upper margin of the bulla. So here this is known as ethmoidal bulla, and it is a rounded elevation, and elevation is due to the underlying middle ethmoidal air sinuses which opens into this upper margin of this bulla. So this is ethmoidal bulla, and which is receiving opening of middle ethmoidal sinus. So ethmoidal bulla is a part of middle meatus. Then beneath the bulla, we have a deep semicircular sulcus. This sulcus you can see over here is known as hiatus semilunaris. This hiatus semilunaris has an anterior part which is known as infundibulum, and that receives frontal air sinus. Then we have in the middle part anterior ethmoidal air sinuses opens just behind the frontal sinus, and the maxillary sinus opens into the posterior part of the hiatus. So this hiatus semilunaris receives opening for frontal sinus in the anterior part, also known as the infundibulum, anterior ethmoidal sinus behind the frontal sinus, and then we have the maxillary sinus in the posterior part of the hiatus. So the middle meatus shows two structures. One is the ethmoidal bulla, which is a rounded elevation produced by the underlying middle ethmoidal sinus, and of course they will be opening into the bulla as well. Beneath the ethmoidal bulla we have a hiatus which is known as hiatus sulcus, known as hiatus semilunaris. This hiatus has an anterior part also known as infundibulum, which receives opening of frontal air sinus. Behind the opening of frontal air sinus we have opening for anterior ethmoidal sinus, and the posterior part of the hiatus shows opening of maxillary sinus. Now the last meatus that is left is the inferior meatus, which of course lies underneath the inferior concha, and here you can see the opening of nasolacrimal duct opens into the inferior meatus. So this opening, so this is nasolacrimal duct, and which is basically the continuation of the lacrimal sac, draining lacrimal fluid from the eye and then carrying this fluid into the nasolacrimal duct, which is being opening into the inferior meatus below the inferior concha, and just at the opening of this nasolacrimal duct there is a mucosal valve, and that is known as valve of Hasner. So the opening related to the inferior meatus is the nasolacrimal duct. Students, let's discuss our second part of the lecture, that is paranasal sinuses. What are the paranasal sinuses? These are the air-filled spaces which are present within the bones around the nasal cavities, and these include the frontal sinus, the ethmoidal sinus, sphenoidal sinuses, and the maxillary sinuses. So there are four sinuses: the frontal, these are the frontal ones, these are ethmoidal ones, maxillary, and the sphenoidal sinuses. All these sinuses open into the nasal cavity through the lateral wall, as we discussed it earlier. Now let's first discuss the frontal sinus. The frontal sinus is located in the frontal bone deep to the superciliary arches. You can see the superciliary arches, and it opens into the middle hiatus. Of course, we did it in the previous slides that it is opens into the anterior part of the hiatus semilunaris, also known as the infundibulum, and it is supplied by the supraorbital artery, and nerve supplies to the supraorbital nerve. So frontal sinus is located in the frontal bone behind the superciliary arches, opens into the middle meatus of the nose at the anterior part of the hiatus semilunaris, supplied by supraorbital artery and supraorbital nerve. Now let's discuss the maxillary sinus. Maxillary sinus is basically is lying in the body of the maxilla. Over here you can see it is a pyramidal shape with the base directed medially and the apex is directed laterally. The base is formed by the lateral wall of the nose. The apex is basically directed towards the zygomatic process of the maxilla. The roof is formed by the floor of the orbit, and the floor is formed by the alveolar part of the maxilla. So it opens into the middle meatus of the nose, just in the posterior end of the hiatus semilunaris, and it is supplied by the superior alveolar branches of the maxillary artery. But it also receives contributions from the greater palatine artery and descending arteries, which is basically supplying the floor of the sinus. The nerve supplies to the anterior, middle, and posterior superior alveolar nerve. So let's discuss the sphenoidal air sinuses. These are right and left sphenoidal air sinuses that lie within the body of the sphenoid and open in the sphenoethmoidal recess of corresponding half of the nasal cavity. Each sinus is related superiorly to the optic chiasma and hypophysis cerebri, laterally to internal carotid artery and cavernous sinus. So over here you can see this is the sphenoidal air sinuses lying within the body of the sphenoid bone, and we did it previously that these sphenoidal air sinuses are opening into a triangular shaped recess just behind the superior concha, and that recess is known as sphenoethmoidal recess. Each sinus is related superior with the optic chiasma, and over here you can see the hypophysis cerebri. It is related to internal carotid artery laterally and the cavernous sinus as well. The blood supply of the sphenoidal air sinuses is the posterior ethmoidal artery, and nerve supply is to the posterior ethmoidal nerve and orbital branches of pterygopalatine ganglion. Then we have the ethmoidal air sinuses. The ethmoidal air sinuses lies within the labyrinth of ethmoid bone. As you can see, the anterior ethmoidal, middle ethmoidal, and posterior ethmoidal sinuses. The anterior ethmoidal sinus was opening directly into the was opening into the middle meatus of the nose. The posterior ethmoidal sinus was opening into the superior meatus of the nose, while the middle ethmoidal sinus was forming a rounded elevation in the middle meatus of the nose, and that was known as the ethmoidal bulla. So it is supplied by the posterior ethmoidal artery and posterior ethmoidal nerve. Let's discuss the applied anatomy of our today's lecture. That is the nasal fractures. Because of the prominence of the nose, fractures of the nasal bone are really common in automobile accidents and contact sports. Then deviated nasal septum. Of course, the name indicates that the septum is lying in the median plane, and if it deviates to on either side, that is known as the deviated nasal septum. It could result due to the birth trauma or a fist fight, usually in adults. And it can cause obstruction in breathing and exacerbate snoring. It of course it will lead to the hindrance in breathing, and the deviation can be corrected surgically. Now let's find out what rhinitis is. As we did that, the study of the nose was known as rhinology. So the inflammation of the nasal mucosa is known as the rhinitis. So when the nasal mucosa becomes swollen and inflamed, it could be due to upper respiratory tract infection and could be due to allergic reactions. The infection can spread to the anterior cranial fossa through cribriform plate of ethmoid bone as it is forming the roof of the nasal cavity. It could spread to the nasopharynx, and it could spread through this opening of the pharyngotympanic tube into the middle ear. It could spread to the paranasal sinuses because all the sinuses were opening in the lateral wall of the nose, and it could also spread to the lacrimal apparatus and conjunctiva as the nasolacrimal duct was opening into the inferior meatus. Now let's discuss what is epistaxis. As we did that, the bleeding from the nose is termed as epistaxis, and it is relatively common because of the rich supply of the nasal mucosa. The causes could be a trauma, infection, or hypertension. Sphenopalatine is usually known as the artery of epistaxis because it is a major contributor of the blood supply in the nasal septum, and bleeding is from the little's area where the Kesselblack's plexus was formed, the four anastomotic arteries, which I have discussed with you earlier, and that area was known as the little's area, and where the capillary network is formed. So bleeding is basically from that area, which is located in the anterior inferior part of the nasal septum. So what happens in the sinusitis? The infection may spread from the nasal cavity into the sinuses, and as the paranasal sinuses are continuous with the nasal cavity through their openings, so it may cause inflammation and swelling of the nasal mucosa. Most commonly involved sinus is the maxillary sinus. So students, in this diagram you can appreciate the different structures which we have studied up till now in this picture from a cadaver. And here you can see several structures. This one is the superior concha, and this is a superior meatus. This is the middle concha, and this is the middle meatus. This is inferior concha, and over here is the inferior meatus. This is the opening of the pharyngotympanic tube. This is hard palate forming the floor of the nasal cavity. This is sphenoidal air sinus. This is hypophysis cerebri, and this is the frontal sinus over here. So this is how the concas and the meatuses look in the cadaver. Thank you so much, students. This is all about our today's lecture. So the most important thing I'm again telling you about the today's lecture were how the nasal septum is being formed, what bones and cartilage are forming the nasal septum, what bones and cartilage are contributing the framework of the lateral wall of the nose, and what are the structures present in the lateral wall of the nose, that is the concha and the meatuses, what structures are opening into the meatuses, what is Kieselbeck's plexus, which four arteries are anastomosing over here, and what is Little's area. So that is the most important thing of our today's lecture. So thank you so much, and I wish you best of luck.